Good evening and welcome back to the COVID-19 update program on Channels Television. I'm Millicent Walker. First, the highlights. Medical practitioners continue the battle against a more deadly wave of COVID-19 as some schools resume. Kaduna State government suspends school resumption over fears of increasing infections. And Britain imposes new travel restrictions to curb the spread of COVID-19. A growing coronavirus second wave is threatening to engulf our fragile healthcare systems across Africa after months of what has been called relatively mild impact across the continent. Officials say hospital capacity and oxygen supplies are running out as the continent-wide death rate this month surpassed the global average for the first time. The reality of the second wave is clearly with us, a picture of the new outbreak due to increased transmissibility. Now, this is why. During the first wave in 2020, a daily count of 400 infections was a big deal. Nigeria's worst day during that wave was July the 1st, our case tally of 790 cases. The infections tapered off until it looked like we were almost free of the outbreak. In November, however, more people started falling ill. The Presidential Task Force officially announced a second wave in December. There's been a daily count of well over 1,000 cases since the 30th of December 2020, except for 2 days. The surge has been attributed mainly to an increase of infections within communities and, to a lesser extent, travelers coming into the country. According to Dr. John Nkagesong, head of the AU's Africa Centers for Disease Control, it is very severe, and he's appealing to African leaders to subsidize masks because for now, they are the best vaccines that we have. So let's look at last night's figures from the Nigeria Center for Disease Control, NCDC, which show the threat of more cases, 1,444 cases, and this is added just last night. The total confirmed cases now stands at 110,387, total recoveries at 89,317, with the death toll at 1,435. Lagos still recording the highest cases. Of the last night's cases, you have 901 cases alone recorded in Lagos State, followed by Plateau in second place and Kaduna, and the rest of the states you can see there. A total of 21 states, including the FCT, recorded cases in the last 24 hours. For those discharged, 717 community recoveries were recorded in Lagos, plus a backlog of 2,825 community recoveries in the Federal Capital Territory. And according to the NCDC, they were managed in line with the guidelines. As with the Federal Ministry of Education statement that schools resume 18th January, indeed, schools resume today across the country, except for a few states who postponed resumption due to the spread of the virus. Let's begin in the nation's capital, Abuja, where students started arriving at their schools and were received by teachers who carried out temperature checks on them before they were allowed into the classrooms. Our correspondent reports that most of the schools visited, students were seen wearing their face masks, but attendance was low, which hints at skepticism from some parents and guardians as to the safety measures in place.
Students in the nation's capital are back in school after an extended Christmas break following the report of the second wave of the COVID-19 pandemic. Upon resumption, the students are subjected to health checks in line with COVID-19 protocols. They also participate in the cleanup of the school premises.
You can see them coming in with their face masks. They wash hands before going in. And they were observing the social distance, no assembly, all the protocol listed by COVID-19. This school is observing it. Office of the Minister of State came to do the promulgation last 2 weeks, and the school did its own yesterday.
And that's where demand is like.
The schools have been rearranged to accommodate the guidelines for school resumption in the classrooms, while the teachers have the mandate to enforce compliance with the safety protocols.
Teachers, if you are going and see any child, if you enter the class, any child without wearing children are children, anywhere they behave their. So, first of all, any child you see without face mask, you will be what? Will be called out of the class. Then, at the same time, those that would have their own inside the pocket, they are children. So they can put their own inside the pocket, they will do what's corrected to wear their own. Then some hang their own by the mouth without covering the nose. You direct them what to do. Then those who didn't come to the school with their own, we made some available at the gate.
The Nigeria Center for Disease Control also mandates schools to carry out weekly risk assessments, while the FCT administration and the area councils are to conduct monthly and quarterly risk assessments for the schools.
In some of the southern states, students resumed in most public and private schools with a high level of compliance with the COVID-19 guidelines in some schools. Although the turnout appeared low, our correspondent Ini John Mekwa reports on the measures to keep the second wave at bay.
In Lagos State, students of primary and secondary schools resume for the second term. They are welcome with COVID-19 protocols to ensure their safety. They've even been taught a song to keep them reminded of the new normal. The Commissioner for Education, Folashade Adefisayo, takes a tour to some of the schools to ensure that laid-down guidelines are followed.
We are not going to leave the schools alone. We are going to keep coming around. We are going to keep holding meetings. We are going to keep talking to them. We are going to keep encouraging them. I talk a lot because I know this thing, they find it uncomfortable. It is. You're uncomfortable, I'm uncomfortable. But like I keep asking, is it better to be uncomfortable and alive?
In neighboring Ogun State, students are subjected to strict screening and hand hygiene.
Then we go to our classes. We have arranged the class in such a way that we provide adequate spacing amongst them. And all in all, our teachers are ready on ground. And you can see that about 80-85% of our students are already in the school.
The picture is somewhat different in Ebonyi State. Students of Urban Secondary School in the state capital, Abakaliki, are happy to return to school as they are seen heading to classes in groups, most of them without face masks.
Not all of them came with face mask. And the government, they were announcing this. We thought that parents are supposed to give their children, equip them. But now we have announced, and we are going to announce by tomorrow, nobody will come here without a face mask.
In Edo State, that schools will not reopen for now.
Some other states, like Edo, have suspended the reopening of schools in the face of increasing records of daily infections. In Kaduna State, while schools are not allowed to open, the State Polytechnic and the National Open Universities are exempted because they requested for time to write examinations.
As the pandemic continues to evolve across the world, there is a need to reevaluate, re-strategize and reinvigorate the COVID-19 response activities to ensure that we are prepared to handle the second and potentially a third wave of cases. Joining us right now is Dr. Ngozi Onya. She's the Medical Director, Palon Memorial Clinic. We'd like to thank you for joining us on the program.
Thank you for inviting me and for having me on the program. Good evening.
First, I'd like to ask why you think that we are experiencing a second wave.
I think it's because it's a global world. Everybody's experiencing a second wave. The world is very interconnected with air travel. So whatever happens anywhere in one place will happen everywhere else. Every continent of the world except Antarctica, where nobody goes, have been affected by the pandemic. So I think it's simply because it's a second wave everywhere else.
Indeed, and most experts are saying putting the blame on human behavior. But would you say that it appears we're having many more people needing more critical care in this second wave?
I'm not quite sure that is true. I'm not quite sure that it's true when we, if we put things in perspective. I think the real issue is that first, there's a lot of media attention, more media attention to COVID than any other illness had ever had, and therefore it's blown totally out of proportion. I'm not trying to trivialize it. For every life that is lost, it's one life too many. There's no doubt about that. But I think I'm under a lot of pressure, and Palon is under a lot of pressure, but I don't think it's so much because the numbers are so much higher, but because also there are fewer centers caring for COVID now than there were during the first wave.
So looking at school results... Go ahead.
And I do agree with you in absolute numbers, yes, because I remember that it took us almost 6 months or more to get to the 1 million mark of deaths globally. And in 3 months or 2, we've reached 2 million. So yes, I agree with you to an extent, yes.
Breakouts were recorded in schools in the first wave, and there are some school infections in this second wave. What would you advise that people pay more attention to?
Sorry, I didn't hear that very well.
So I was just going to ask about the second wave and how we had, breakouts in schools in the first wave and a few more recorded this second wave. But what would you advise that people pay more attention to? Or are you those that would advocate for perhaps a closure of schools in the meantime?
To be honest, if my opinion was sought, I would say the very young children should not go to school. They should stay home. But the school-age children, the children from primary school who you can appeal to, who you can explain to the reason for the social distancing, the reason for the masks, I think should be allowed to go back to their lives. Because the honest truth is we don't know how long this will go on for. And we cannot afford to keep all our children who, the more privileged children can access education online. What about the underserved children? This will further set them back. So I will advocate that the much younger children under 5 should stay home, but the older children should go back to school, maintaining, of course, the protocols for prevention of COVID. Mask wearing, hand washing, avoid touching your face. Sick children should not be allowed in school, so anybody who's ill should stay home.
What are some of your other expectations, especially for the Presidential Task Force on COVID-19 and this is also as it affects, Nigerians as we experience the second wave?
I think that they need to ramp up testing, and I think we have ramped up testing. I think we need some collaboration between the private sector and the public sector in terms of beefing up capacity for providing care. There's under capacity, so the systems are overwhelmed by the sheer numbers we're having to deal with. And I think the only way that we can ramp up capacity very quickly is to use the infrastructure that belongs to the government and the technical skills of the private sector to quickly, ramp up capacity to be able to provide care.
Finally, okay.
I will also appreciate a bit more visibility of the government in terms of enlightening the public as they did during the first wave that COVID isn't really gone. It's still there. In fact, it's back with the bang.
I was also going to jump in there to ask you to, give us sort of refresher course as to why this virus is so much deadlier than, say, a common cold or catarrh.
I think the main thing is that it's novel, it's new. That's the first thing. Secondly, I think it has mutated. And, with mutations, you have survival of the fittest. So the fittest viruses are the ones that are being spread now, being propagated. I think also it's a lot of media hype as well. It's a lot of media hype. Yes, it's deadlier than the common cold, but people die of influenza in the course of a year. There's not 2 million people in 1 year for sure. But also probably because it's a novel virus, we haven't built up immunity against it yet within the human community. Maybe that's the reason why. But no one is quite sure. But I must keep bringing it back to focus that there's a lot of media hype around COVID. I try to check up. Malaria kills 300,000 people every year in Nigeria. 300,000 every year in Nigeria. COVID has killed 1,450 people that we have recorded. And just like with I recognize that this is probably underreported. Also, malaria cases are also underreported. So let's put it in context. It's less than 0.5% of the number of people who die every year of malaria that are dying of COVID. They have died of COVID in the last 1 year. But of course, it's also very newsworthy because it's the more prominent members of society, this time, not the underserved. And that's the reason why we have all this attention on COVID as an illness.
All right. We'd like to appreciate your time. Thank you so much, Dr. Ngozi Onya, MD, Palon Memorial Clinic. Thank you for joining us on the program.
Thank you. Bye.
Still ahead, fear and stress levels creep in for some parents in Bayelsa State over school resumption. Please stay with us. Parents in Yenagoa are expressing concern over the resumption of school as they fear the exposure of their children at school may increase the risk of transmission of the coronavirus. The Bayelsa State government had earlier made the use of face masks in public places compulsory for everyone, but compliance level remains low. Here's more, our correspondent Dobra Timiwood.
To curb the rapid spread of the coronavirus in Bayelsa State, most educational institutions would require an auto-disinfectant system such as this. We spoke with a cross-section of parents in Bayelsa State who are expressing concern over the fact that their children may have to go to school without an auto-disinfectant system such as this and would only rely on the use of face masks and hand sanitizers.
The school resumption, for me, I'm in support of the school resumption subject to strict observance of COVID-19 protocols and standards. I know that many schools are yet to have full gears that will protect contact and spread of the virus, especially this era of the second wave or spike of the virus. But I think that we must continue to go to school and our children must continue to be taught.
Today I was on my radio listening to how far the corona pandemic has been threatening and schools are resuming. Someone like me, I'm a father. I'm thinking on how to do about it, if I'm to release my son to the school or not, and I have a grown-up child that is in the university. So I'm also thinking if it is possible for this boy also to go to school, because it is very, very risky. And I want to use the opportunity to urge the coronavirus task force team to put things in place to see that students are safe and secured.
The Bayelsa State government had earlier made the use of face masks in public places compulsory, but the compliance level is observed to be very low at the moment. From Yenagoa, Dobra Timiwood for COVID-19 updates.
Joining us for more, especially looking at the vaccines for COVID-19, is Dr. Bassi Okose. He's the Director, Disease Control and Immunization with the National Primary Healthcare Development Agency. He joins us from Abuja. Thank you for joining us on the program. I'd like to begin by asking when you think that the 100,000 vaccines will arrive and how they will be distributed.
Well, good evening, Nigerians. The 100,000 doses of the vaccine first arrival is expected ending of this January. And with the efforts of the technical working group, because I need to mention here, we have a technical working group for COVID-19 vaccine introduction in Nigeria. That working group is chaired by the Executive Director, Dr. Faisal Shoaib. And then we have in that team representatives from the Federal Ministry of Health, NCDC, NAFDAC, all of the Federal Ministry of Finance, Information, NTA. We have from the UN, donors and partners. We also have professional bodies, CSOs, that are members of that team. And then we have a strategic team that also made up the ED of the NPHCDA, the DG NAFDAC, the DG NCDC, the WHO country rep, UNICEF country rep, and a few other team leads in the country that meets twice in a week, while the technical working group meets every day. The whole essence of these intensive, rigorous meetings and reviews for the past 2 months is to ensure that once we receive the vaccine, from the first batch to the fourth batch we are expecting, it will get to all priority Nigerians in all parts of Nigeria, that we can assure Nigerians that everyone will receive those that are priority team to be immunized.
So the federal government wants to cover 40% of the population in 2021. This will require about 84 million doses of the vaccine, yes?
Yes, right.
So this will, be about...
Yes, you are right.
Go ahead.
You are right. We are expecting to reach 70% of Nigerians, 40% in 2021, the remaining 30% in 2022. This majorly because of the vaccine availability globally. Now, when you look at the 40%, we are talking about, like you said, is about 84.5 million Nigerians we are targeting to reach this year. And because of the expected shipment arrival of the vaccines, we are expecting to vaccinate Nigerians in 4 phases. Phase 1 will be this Q1, when we receive the first consignment about 100,000 doses. Phase 2 will be in Q2, where we are expecting about 12% of that 40% being supplied. In Q3, another 17% of the vaccine supply requirement will come. Then in Q4, about 12% will come. So, but that be what it is. The minister, the executive director, all the DGs, the PTF, and everyone is working hard to ensure that we fast-track the arrival of these vaccines. So the introduction dates in those 4 phases is flexible. If the vaccines are acquired faster than planned and promised, we will also ensure that we reach those targets earlier than those quotas that we are talking about. Over.
Hopefully we'll have you join us again before and even as we expect the vaccines at the end of the month. We'd like to thank you, Dr. Bassi Okose, Director, Disease Control and Immunization with the National Primary Healthcare Development Agency. Thank you for joining us.
Okay, thank you. Just to tell Nigerians that please don't be afraid. The vaccines are safe and effective, so prepare to get your shot. Thank you, bye.
We might need a whole program for that. Thank you very much. Let's go on to the international scene where the UK government has begun tightening border controls from today to prevent new strains of COVID-19 coming into the country. All passengers must now have a recent negative coronavirus test and transfer immediately into isolation upon arrival. Here's more on the global update.
Britain's new travel restrictions stem from last Thursday, when the country banned arrivals from South America, Portugal, and some other countries over fears about a strain of the coronavirus detected in Brazil. The country has already felt the effects of mutations in the virus firsthand. A strain first discovered in England has proven to be more transmissible and a major factor behind a spike in cases across the country. Meanwhile, pressure on hospitals continues to grow in Spain after the country reported a record 40,197 new COVID-19 cases. The incidence of the disease measured over the past 14 days hit a new high of 575 cases per 100,000 people, climbing from 522 cases the previous day. Health officials have blamed lax adherence to restrictions on travel and socializing over the Christmas holidays for the surge in cases, which has prompted several regions to tighten measures over the past week. Over in France, 7 Nobel Prize laureates were vaccinated earlier today in an effort to convince the French public that vaccination against COVID-19 is safe and beneficial. The men, 4 in Paris, 3 in Strasbourg, are all scientists. They were invited to receive the vaccine by Alain Fischer, the immunologist coordinating the country's vaccination strategy, in order to show that men of science have faith in the vaccination process.
Now, even though there's evidence that younger people are at lower risk to COVID-19, low risk doesn't mean no risk. Continue to take responsibility. Visit our website, channelstv.com. It has more updates, also give you a better understanding of the pandemic. Plus, you find other stories there as well at your fingertips. That's a COVID-19 update. Thank you for watching. I'm Millicent Walker. Stay safe.